Hello, my name's Tim Bird. I'm the Employment Lead for the North East Mental Health Development Unit, otherwise known as NEMDU. I'm seconded to that organisation from Job Centre Plus and have been for over the last 3 years. The reason why I was seconded across there was to help develop the Statement of Priorities on Mental Health and Employment, and from that develop a regional employment team to deliver those priorities through an action plan. The reason these priorities were developed was because of the low levels of employment, education and training being undertaken by people with mental health conditions. Lots of organisations within health, social care, employment, third sector, service users groups all recognised that there was a need for a concerted effort to deliver better outcomes in those areas. The key and effectiveness to all things related to mental health and employability are partnership working. The partnerships need to recognise the professionalism of many different organisations who are involved in it. Not only the professionals within health and social care, but those within employment who bring their unique skills and understanding of labour markets, education and training. But also, more importantly than that, are the skills and knowledge which are available from the mental health service user themselves and their groups that support them. They are the greatest resource within the partnership, and the key to the successful partnerships is recognition of the unique skills that all organisations bring together that, when complemented together, will achieve outcomes that are successful for the service user themselves, which are appropriate to them, which meet their needs and aspirations and address many of the targets and aspirations set in the government policies which were released over the last few years. As examples of successful partnership working, we have had the major achievement of County Durham, where a mental health and employment strategy was developed from the Public Sector Agreement 16, which was about improving the numbers of people with severe mental health conditions who were in employment, education or training. This was achieved through forming a group which got together key stakeholders who mapped out and recognised the people who needed to be involved in a partnership and developed from that an action plan which is owned by all partners, including the service users involved in that group. A further example of that would be the Individual Placement and Support Scheme pilot, which was delivered within the City of Sunderland. This successfully moved many people with severe mental health conditions into employment, into higher and further education and vocational training. This was achieved through partnership working through social care, employment and third sector organisations. It included Job Centre Plus seconding staff across to the Early Intervention and Psychosis team and to the IPS project itself to help deliver successful employment outcomes, benefiting not only Job Centre Plus, the City of Sunderland Council, but the service users who engaged with this. That supported. A lot of work and funding was put in by myself through NEMDU to develop this tool, because we recognised early on from the Statement of Priorities that key workers needed tools to help support them meet the needs of the individual person with a mental health condition. The development of this tool has been very successful and used in partnership. DWP within parts of the North East region have used it as a training tool for their frontline staff to help support that. We're also looking to use it with work programme providers and with work choice providers to ensure that they have the knowledge, the skills and develop the right attitudes to meet the needs of the individual person with a mental health condition. The new strategy for mental health, no health without mental health, is a key driver. It supports NHS outcomes frameworks, adult social care frameworks and public health frameworks, which all state that there needs to be more opportunity for people with mental health conditions to enter employment, training or higher or further education. And to deliver that, we need to have the tools. The Take 10 Toolkit is that tool and supports and complements lots of others available. We're very proud in the region to have been involved with that, and we hope that in the future it continues on and continues to develop as a web-based resource. Partnership is the key, everybody. Remember that.